The following segment is sponsored by Northern Nevada Health System.
We are here at the Northern Nevada Medical Center with Dr. Alexander Ayzengart, who's a bariatric surgeon, talking about issues when it comes to the esophagus and the stomach. How are you?
I'm good. How are you, Chris?
I'm well, because I'm not afflicted by that, but it's a common affliction, it seems, more and more. At least it's on your radar.
Yeah, absolutely. Diseases of esophagus and stomach usually affect most of the United States population in some degree or another. And a lot of times people don't really appreciate the severity of the symptoms or what's exactly causing it. So it's my job as a specialist who focuses on the esophagus and the stomach to be able to find the reason why people are afflicted with certain conditions and hopefully treat them to the point where those conditions are gone.
Okay, so you mentioned symptoms. What kinds of symptoms should trigger a visit here to Northern Nevada Medical Center?
Absolutely. So it can be anything from abdominal pain, usually it's upper abdominal pain, to nausea, vomiting, significant amount of reflux that's not being helped by usual lifestyle modifications. You can have bloating, belching. You can also have issues with the food getting stuck in your chest. All of that can be a significant medical condition that's caused by either an esophageal or stomach problem.
Okay, so you mentioned some of the things like diet and everything else. What are some of the preventative things that you might suggest to a patient?
Right. Usually a healthy lifestyle tends to help alleviate or at least prevent some of these symptoms. Avoiding certain types of foods, being spicy foods, foods high in salt or high in preservatives, and in general trying to lead a reasonably healthy diet and lifestyle tends to avoid certain problems with digestion.
So there's a difference between stomach and esophagus disease versus an upset stomach or a sore throat or any sort of acid reflux or something like that. Can you compare the two? In other words, if we take a Tums and Rolaids, but it doesn't work, then there might be something more serious that's underlying?
Possibly. So it's normal to have a physiologic amount of reflux or certain indigestion or abdominal pain that usually goes away within minutes to hours. You know, if some symptoms persist longer than a few hours or they tend to get worse and worse, that's usually a sign of a medical condition that should be looked at. And oftentimes medications are being offered as a first-line therapy, but if the medications don't work, we have other solutions as well, including surgery.
Okay, and beyond this short discussion, Doctor, you have an event coming up on June the 6th where people can learn more about this?
Yeah, no, absolutely. So we have a lecture series for basically people in the community that's put on by the Northern Nevada Medical System, and we will talk about diseases of the esophagus and the stomach.
Okay, very good. And then to register for that, we would go to nnhs.com/events, it sounds like. Yep. And you'll be there as one of the presenters?
Yep, I'll be me as well.
Okay, Doctor, thank you so
My
much.
pleasure.
Really appreciate it.